name is Alissa McDonald, and I'll be performing the validation of giving a patient a bed bath. I'm going to first recite the 7 steps. 1, check physician's orders. 2, identify the patient. 3, introduce myself. 4, explain the procedure. 5, gather my equipment. 6, wash my hands. 7, provide for privacy. So first and foremost, before we start with bed washing, I'm going to make sure the patient does not need to use a bedpan. He does not need to use the bedpan, so I'm going to start. First and foremost, I'm going to raise the bed up to my working height, making sure that the patient is lying flat. This is a good height for me. I'm going to lower this eyebrow, and I'm going to remove the top sheet. So most importantly, when giving a patient a bed bath, we want to provide privacy. So before removing the gown, I'm going to cover him with a bath towel. And now I'm going to remove the gown while keeping him covered. Okay. So I've just removed the gown. I'm going to start with the head, face, and neck area of the patient. So I'm going to place my towel underneath the head so we do not get the pillow or the bed wet. Now I'm going to take my basin full with warm water and my washcloth. I'm not going to be using soap since we're going to be near the face and eye area. I'm going to take a corner of my washcloth and work the inner canthus of the eye to the outer. So I'm going to not get it dripping wet with the warm water, but a little wet. And I'm going to work the inner canthus out, taking another section of the towel to work the other eye, inner canthus out. I'm going to pat dry with the towel underneath the head. Now I'm going to proceed to wash the rest of the face. I'm going to get some water. I'm going to wash underneath the chin. I'm going to check ears, wash the ears, check for leakage, any bony prominences back here that are red, as well as the other side. I'm going to get the neck area. I'm going to be mindful of his trach. And now I'm going to pat dry with this towel that we have here on the bed. Okay. So now we are going to be working the arm area. So I'm going to expose the arm that I'm going to be working with. Here it is. I'm now going to be using soap with my basin of warm water. So I'm going to soap, have my washcloth, and I'm going to work from the fingertips, holding at the joint of the wrist, fingertips up. But before I've done that, I've removed this towel underneath his head, first and foremost, and I've placed it underneath this arm. I forgot to do that stuff, but that's what I would do before I worked to the arm. So I have this towel underneath. I have soap, my washcloth. I'm working from the fingertips up, holding the wrist at the joint while I'm washing the hand, holding the elbow. I'm going to get under the axilla. Now I'm going to take my other washcloth and rinse, again working from the fingertips, hold the wrist, rinse, hold the elbow, get under the axilla, back of the arm. I'm going to take this underneath towel and I'm going to pat dry, get really well in between the fingers because we don't want to get any dampness in there. I would put lotion on, but not in between the fingers. So I'm going to remove this towel. I'm going to cover back up. And now we're going to work the other arm and start with bathing that. I'm going to uncover the arm and expose it, put the towel underneath, making sure everything else is covered for privacy. Soap, my washcloth, again working from fingertips, getting in between there, holding at the wrist to wash the hands, elbow, arm, up into the axilla, underneath. Okay. I'm gonna get my washcloth and I'm gonna rinse, get in the fingertips, hold at the wrist, hand, elbow, arm, axilla, and underneath. At this point, I'd ask the patient to do some range of motion. If they need my assistance, I will actively assist. I'm also going to assess for any redness, sores, anything out of the ordinary. So that is done. I'm going to remove the towel. And now we're going to start with the chest. So I'm going to place this towel underneath the patient since we're going to be working the chest. Place it underneath the back. I'm going to lower, still keeping the rest of them covered for privacy. I'm going to take soap, my washcloth. I'm going to wash the chest, mindful of the trach and any wires. Get in the creases really well. Check for any redness, anything out of the ordinary. Take my damp washcloth to rinse. Rinsing, getting in the creases. And with the towel I have underneath, I will pat dry. Dry really well in the creases. Now, with the towel staying underneath the patient, I'm going to work right down to abdomen. So again, I'm going to take my washcloth and soap, get in the abdomen, get under the umbilicus in there, wash. I'm going to take my towel, rinse really well, and I'm going to pat dry really well, especially in the umbilical area. Any creases in the stomach, any folds, excellent. So I'm going to cover back up and remove the towel.
That was awesome, man.
Now we're going to be moving to the legs. So I'm going to expose one leg. I'm going to place the towel underneath the leg so we don't saturate the bed while we're washing. My basin with my warm water, my soap, my washcloth. I'm going to soap it up. I'm going to work the feet, get in between the toes, the heel, calf, shin, holding always at the joints, up into the groin. Okay, I'm going to get my towel to rinse, toes, sole, heel, calf, shin, holding at the joints, knee, hamstring, quad, up into the groin. I'm going to remove my towel and do the same to the other leg. I'm going to expose this leg, put my towel underneath. I'm going to wash with the soap, get in the toes, sole of the feet, heel, hamstring, quad, shin, calf. Now I'm going to get my towel to rinse, toes, heel, calf, shin, hamstring, up to the groin. And now I'm going to use this towel to pat dry. I'm going to dry really well in between the toes and the whole rest of the leg up into the groin since it could be a fold. The same thing with the legs. I'd ask them to do any range of motion themselves. If they need any help, I will be helping. I would put lotion, but never in between the toes, any wet, dampy area. I've removed the towel, and now I'm going to be getting new water. I'm going to be changing the water, so to do the back area. So I'd put the guardrail up. I'd lower the bed to the lowest position. So I'm going to leave the patient with the call bell. I'm going to explain to them that I'm just going to be changing my water to work the back area. So I've disposed of my gloves, I've washed my hands, I've gotten new gloves, new water, and now we're ready to do the back area. So I'm gonna raise the bed back up to my working height, and I'm gonna have the patient roll onto their side. So this is a good working height area for me. I'm going to remove the bed rail. I'm going to turn the patient. So I'm gonna ask them if they can face that direction for me. Raise this arm, cross their chest, have them cross this leg underneath here for me. And on the count of 3 with a good stance, keeping mindful of my body mechanics, I'm gonna ask them to roll. And if they can, lift this arm up if they can, if they can just hold onto the rail for me. If not, I can always ask somebody to hold and help me hold the patient. So, I'm gonna take my towel. I'm gonna put it back here so we don't get the whole bed saturated and wet. Okay, I have my soapy water and washcloth. I'm gonna get my soap with my washcloth, and I'm gonna wash the whole back area, underneath the shoulders, all the way down. I'm now getting the gluteal area. I'm gonna wipe front to back. I'm definitely gonna check for any redness, any bed sores, any bony prominences. I don't see anything. I'm gonna get my warm water to rinse. I'm gonna rinse the back, underneath the shoulders, the spine, gluteal area. Once again, front to back. And I'm going to now pat dry with this towel that we placed underneath them. And I really want to dry the gluteal area really well. It's front to back. I'm going to remove this towel, and I'm going to explain to the patient that we'll be rolling back onto their back. And I'm going to ask them to roll, helping me with whatever they can. Bring this arm back, over, and we're going to cover for privacy. They can uncross this bottom leg for me now. I'm going to put the guardrail back up because we're going to be getting new water for the peritoneal area. So I'm putting the guardrail back up. I'm explaining to the patient, giving them the claw bell, that I'll be getting new water, and we're going to wash the peritoneal area. So I've left them with the claw bell, have the guardrail up, bed down flat. I'm now going to go get new water, new washcloths. I'm going to wash my hands, get a new pair of gloves. So I've come back. I'm going to reposition the bed up to my working height. This is a good height for me. I'm going to bring the railing down. I'm going to ask the patient to bend their legs for me so we can wash the perineal area. So they're going to bend, planting their soles of their feet to the bed. I'm going to put a towel underneath them. I'm going to ask them to actively lift up their bottom, but if they can't, I will help them. Okay. Excellent. I have my soapy water and my washcloth, well, my warm water with my soap and my washcloth. And I'm going to wash the outer part, front to back. I am not going to put the soapy washcloth inside their genitals. If this is a female, if it's a male, inside the urethra. I'm just going to wipe and wash front to back, getting well in there. If there's a catheter, I'm going to make sure I'm cleaning the meatus and there's no discharge that I'm viewing or seeing of any kind. Now, I'm going to get my warm water. I'm going to rinse front to back, get in there really well, getting in the anal area as well. And now with this towel, I'm going to make sure I pat dry really well in this area, especially if there were folds. I'm going to make sure the meatus of the catheter is really well dried off, which it is, so we're good. I'm going to remove this towel. I'm going to remove my basin with warm water, tell the patient they can put their feet back down flat. I'm going to cover them back up for privacy. And at this time, I'm going to give the patient a new gown. So I have my gown at the bedside. And I start with the top, with the arm, keeping them covered, once again for privacy. Now work it over to this side with the arm. Okay. Come underneath here, making sure that there's no pulls, everything's flat. I'm going to remove my bath towel, making sure the patient's comfortable. And at this time I would stop because now we're going to be making a bed, an occupied bed with a patient in it. So I'd be removing all linens and giving new ones.